Hello everyone. Today, we're exploring the medication Levalbuterol, commonly known by its brand name, Xopenex. As always, this discussion is for educational purposes only. For any health-related questions or concerns, please consult a healthcare professional. Description: Levalbuterol, also recognized under the brand name Xopenex, is an inhaled medication belonging to the class of short-acting beta agonists, SABAs. It is primarily used for the treatment of asthma symptoms and to prevent and treat bronchospasm in people with reversible obstructive airway disease. Levalbuterol works by relaxing and opening air passages in the lungs, making it easier to breathe. It is available in forms suitable for both adults and children, including as a solution for nebulizers and as an inhaler. It's also used in emergency settings to alleviate acute asthma attacks. Warnings: Levalbuterol should be used with caution. It is not intended as a regular asthma medication but rather for the relief of acute symptoms. Overuse of this medication can lead to decreased effectiveness and an increase in side effects. Patients with a history of cardiovascular diseases should use Levalbuterol with caution, as it can cause palpitations, increased heart rate, and elevated blood pressure. Before taking this medicine. Before using Levalbuterol, it's important to inform your healthcare provider about any allergies to Levalbuterol or other sympathomimetic bronchodilators. Discuss your complete medical history, especially if you have heart disease, high blood pressure, epilepsy, diabetes, or an overactive thyroid, hyperthyroidism. If you are pregnant, planning to become pregnant, or breastfeeding, consult your doctor to weigh potential benefits and risks. It's crucial to avoid any medications that might interact negatively with Levalbuterol, including some antidepressants and other bronchodilators, unless advised by your doctor. Side effects: While Levalbuterol is effective in treating bronchospasm, it can cause side effects such as tremors, nervousness, dizziness, headache, insomnia, nausea, and an irregular or fast heartbeat. Some serious side effects include chest pain, palpitations, and severe allergic reactions such as rash, hives, and swelling of the face, lips, or tongue. If you experience any worsening of symptoms or signs of severe reactions, seek medical attention immediately. Interactions: Levalbuterol can interact with other medications, which can alter how your treatments work or increase your risk for serious side effects. Always let your healthcare provider know about all the drugs you are taking, including prescription and over-the-counter drugs, as well as any vitamins and herbal supplements. Dosage: Adherence to the prescribed dosage of Levalbuterol is crucial for managing asthma symptoms effectively. For adults and children, the typical dose using a nebulizer is 0.63 mg to 1.25 mg, administered 3 times a day, about 6 to 8 hours apart. Always use Levalbuterol exactly as prescribed by your healthcare provider. Do not increase your dose or frequency without consulting your doctor. Avoid: When using Levalbuterol, it is important to stay hydrated and avoid any known asthma triggers, such as allergens or exercise, if not managed properly. Avoid smoking and being in polluted or very cold air. It's also advisable to avoid taking more doses than prescribed, as this can lead to adverse effects and potentially exacerbate your condition. FAQ: A common question about Levalbuterol concerns its suitability for children. Levalbuterol is approved for children as young as 4 years old, depending on the product form. However, the safety and efficacy in younger children and infants are not well established, so always consult a pediatrician. Closing: That concludes our discussion on Levalbuterol. This overview is meant to inform and educate. For personalized advice and to address any concerns about asthma or other respiratory conditions, please consult your healthcare provider. Thank you for joining today's session.